So, there's usually we talk about the iron triangle of cost, quality, and access.
Right.
Choose any two, and if you want to have three, then that's a
That's
problem.
difficult, yeah.
And so, in the last 20 years or so, in fact, slightly longer, focus has been on digital health, and it's had different forms called e-health, m-health, and so on. Digital health's topic now, and part of the idea is that with um, with convenience in particular, if you don't have to wait to make an appointment, but you can actually connect with somebody either asynchronously or use technology, then you're going to help on the convenience side. It may help on the cost side as well, and maybe even on quality. So there have been various iterations of digital health over the years. What's new now, and those things take a long time
Right.
in healthcare. So those are still working their way through. And during the pandemic, they went crazy. All of a sudden, we've been talking about doctor-patient consultations online literally since 1999. I've been involved in it then. And then in 1 year, actually in 2 weeks, in March of 2020, you had the use of visits, remote visits, go from less than 1% to like 50% in some places. It's just unbelievable. And now that's come back down, but okay, you could see, wow, it can happen, it could work, it's there. We have this challenge that we were talking about before about healthcare staffing. And so I think any founder now has to consider, what are you going to do that doesn't really require people? Digital health is part of that, but it's potentially really accelerated by artificial intelligence. And some AI has been used in the past, but if you consider now, what makes it difficult for a physician to operate, to have their practice. Some of it has to do with these conspiracy theories, lack of staff, and so on. But a lot of it has to do with the bureaucracy, the paperwork, looking things up in a way that's clunky with electronic medical records and references that they have. The promise of artificial intelligence is really fairly profound. So instead of having to spend a bunch of time writing a note to a patient or writing up notes, if you can use generative AI to get the main issues out and then express it in ways that you're actually comfortable with and is not hallucinating, that's very powerful. And then there's other places too. Like if you look in clinical trials, difficult to recruit patients for trials. It's hard to find patients that are going to be eligible. So instead of going through all the medical records by hand, which can take a long time, or even in a semi-automated way, if you can use artificial intelligence, you can identify individuals that may be, based on their characteristics, that's an undiagnosed patient in this category. And so their treatment, if they haven't had the drug before, they would be good for a clinical trial and so on. You accelerate that radically. There's no danger in that, because if you have a false positive, that's going to be weeded out when you actually bring the patient in and screen them and enroll them in the trial. So I think the combination of artificial intelligence and digital health are the areas that people are looking at. Correspondingly, if somebody just made an investment a couple of years ago in something that was digital but didn't use AI, they're thinking, well, wait a minute, is my whole business model going to go away because AI is going to take it over? So it's made things exciting.
I mean, what I can see is that there's clearly a difficulty with medical records. Like, we are playing around a lot with AI at Cassandra these days, and I can just like not imagine, because my medical records are spread all over, right, with the different places. So if you kind of can't combine them, how can AI give me anything? Because the data is like spread, like the accuracy will be so much lower. So like, who's working on this problem? Actually to bring speed on, on the AI front in the first place.
Well, we didn't. So we didn't discuss this before, but you've teed it up nicely. So one company that I'm an investor in and advisor to is called Credo, CREDO, Credo Health. And what they do is take advantage of something else that's going on, which is this trend toward interoperability. Right. In the US in particular, the care is spread across many different settings, and they have electronic medical records thanks to the HITECH Act and the Affordable Care Act from about 10 years ago or a little bit more. But those records haven't been able to talk to one another. And so what happens now is there is this push toward interoperability, and there's some government frameworks and regulations. TEFCA is one of them that allows the they disallow the blocking of sharing of records. So for patient care, you need to actually be able to share the records. Now you need to be able to also to link those records up. And so a way that's being done is that the patient's giving consent for a company like Credo to be able to go and gather all that information, or they get the consent from the physician who's treating them. The physicians now have an incentive, actually under Medicare Advantage that we talked about before, to get that whole medical record, because they get rewarded based on the severity of the patient's condition. So if they have all their medical records ahead of time, then they can do that. So we've got a combination of regulatory reform that allows the interoperability so that the records can be shared from a technical standpoint. We've got a business model where the physicians actually want to see those records in advance so that they can get paid. And then there is the artificial intelligence portion, which can pull some of this information together. And in particular, you've got in the medical records, you'd think about it as a structured data, but it's actually only about 20 or 30% of the information is structured in fields like what's the blood pressure, heart rate, and so on. And a lot of the information is actually in those unstructured notes. So the artificial intelligence, and in particular natural language processing, is useful in order to be able to bring all that together. There's another company that we work with. It's actually in a private equity portfolio owned by BV Investment Partners that's called Celerity. And this company actually does medical record indexing. So a big issue is that hospital systems, even if they're using an advanced medical record like Epic, when somebody's going from one hospital system to the other, those don't talk very well, despite this move toward interoperability. And so what they do at Celerity is they will bring the data from one record and be able to put it in the other record. So from hospital A to hospital B, and that involves a great degree of trust and care in order to make sure you've got the right information going into that other electronic medical record. So it's a combination of human interaction, just very good workflow, and also technologies like OCR, NLP, and AI.